Dr. Robert Lelouch, a board-certified OBGYN with over 30 years of clinical experience. And this is another short video about labor, and today we'll talk about pain management during labor. Now this is a really big topic, and I'm not going to give you a review of all the different options out there. I'm going to just give you more of what are my experiences and what are my observations. So, for example, right now, nitrous oxide, which is laughing gas, is been used throughout the world and is starting to become popular a little bit. I really can't comment on that. Never had any direct experience in labor and delivery. What I do have experience with is epidurals, with anesthetics or opioid analgesics like morphine or some other similar medicines, and some local injections, and also patients with no interventions or with Lamaze breathing techniques or the support of doulas, and no direct pain management. So we'll go over a little bit of that. To make a long story short, I'm a big fan of epidurals. I think they're great, and most of the patients that I see who have epidurals or who have labors, have their baby, do great with epidurals and have a very wonderful, nice experience. That being said, if you don't want an epidural, that's perfectly fine. If you want whatever your preferred technique is, work with your team, and that's okay. You're not at all obligated to have it. It's just, in my years of experience and thousands of deliveries, I find overall in balance that the epidural provides the safest, most pleasant experience and memorable experience. Memorable meaning your memories of the delivery are not about pain, about the whole labor and delivery process. They're about bonding, excitement, nervousness with your partner and seeing your baby. For example, narcotic pain medicines have been used quite a bit, but they make you a little drowsy, a little sleepy. They can also affect the baby some, but they also make you forget. So much of your memory is foggy afterwards. An epidural, there are some very small risks. Never in my life have I seen anyone get paralyzed, but they all say that since it's near the spinal cord, that is a risk, but it's really minimal. I've never heard of it. There's a couple of risks of the epidural that are more common. One is not working. It's not a guarantee. I would say about 1% don't work well, or they don't work. That's frustrating, but not a giant one. A spinal headache also can happen, and I would say that's about 1 in 100. You'll have to talk to your anesthesia team about how often that occurs, but a spinal headache is no fun. And that means you get a pretty bad headache after you deliver, and you have to lay flat for a day or so to get it to go away. It's from the fluid leaking a little, and that fluid, cerebrospinal fluid, is around your spinal cord, and it bathes your brain, and when it leaks a little, it can hurt. Sometimes you need something called a blood patch, where they inject some of your own blood back in to seal it up. So that's happened not too often, but for those who decide not to have an epidural because they're worried about the pain of that rare event, I will tell you that if you have lots of discomfort, that's a guaranteed given for the whole duration of your labor, if you're in pain. Not all women are in pain during labor and delivery. I have yet to figure out who that woman will be before she goes in labor. I have patients tell me, oh, I've got a high pain tolerance, and they're in agony and they're miserable. And I have other patients tell me they can't take pain at all, they have no pain tolerance whatsoever, and they're talking to me in my office. They're 9 centimeters dilated in the office, not even thinking they're in labor, and I send them to the hospital. 20 minutes later, they're not pregnant. They just didn't have lots of pain. So if you're not sure what you want, I encourage you to have an open mind, explore the options, and see how you do. If you're one of the lucky ones who the Lamaze class, the breathing techniques, the support from your spouse or your partner all helps you get through it, great. You don't need it. You don't have to. If you're in agony, you're miserable, then my first line recommendation are epidurals, and there are very few times where it's not appropriate, but there are some. And with good management of labor, I personally have not experienced a reduced there were some older studies saying that maybe it would delay delivery or that it might increase the chance of a C-section. I can tell you the national average for a C-section is about 30%, and mine is well under 10%, and I encourage epidurals and have a high percentage of patients with epidurals, and they don't have high C-section rates. I can tell you from personal experience with my son, who's now 11, my wife didn't want an epidural. She was terrified of the epidural. I said, okay, fine. And in the beginning of her labor, she was very uncomfortable, very miserable with all the discomfort. And about halfway through the pregnancy, halfway through the labor, she decided to get the epidural. Afterwards, it was a miracle. She felt great. She took a nap. She wasn't exhausted. We watched a movie. We watched Night and Day with Carmen Diaz and Tom Cruise. And now every time we see that movie, we think of how much laughing and fun and excitement we had for my son's delivery. So those are not rare stories. They work really well. There's always something we can do to help control your pain and discomfort. We can also give you some local injections of numbing medicine for the actual delivery process. So it's important to have this discussion with your physician to understand what some of your options are and know that you do have options, and nothing will be forced on you, and there's no reason to have uncontrolled discomfort, that we can always intervene or do something to give you a more pleasant experience. I hope you found this helpful, and look for other videos on the labor process. Thank you.